We got a phone call from Claire, another made up client of ours. She is 40 weeks and 2 days today. She called to say that for the last about 5 hours, she's been feeling her contractions pretty regular. She started timing them maybe 30 minutes ago, and they're about 5 to 7 minutes apart, 30 to 40 seconds long, but closer to the 5 minute mark. So we kept her on the phone for a while, just trying to listen to her voice and deciding, checking out how she's feeling in general. And we asked questions like, has her water broken? Has she seen any spotting or bleeding? And she said no to both of those. She does feel like she lost her mucus plug yesterday. It was just a tiny bit pinkish when she went to wipe, and she's had diarrhea all day yesterday. And then we got a chance to listen to her during a contraction, and she did have to pause and just breathe through the contraction. So we decided to head on over to her house to check on her. So once we got there, we walked in and met with her husband that was there, her support, and asked her how she's doing, how she's feeling, and started off by doing her vitals. We checked her blood pressure, pulse, and temp, and then we had her sit or lie down so we can palpate her stomach and make sure that the baby is in a good position. So this is my Claire over here. Pillow is the head, and this is her belly. So making sure that it's in between contractions so the belly is soft, that you can feel. What we're feeling for is making sure that the head is not up here. It's just the bottom is up here, where the back is at, if it's on the side, if it's in the front, if it's on the left side, and then making sure that the head is nice and low. And then we listened to the baby for about 5 minutes. We tried to listen to before, during, and after a contraction, just kind of checking how the baby is tolerating the contractions, if there's any decels, if there's any arrhythmia that's unheard, which her baby sounded great. It was rocking. It was perfect. And then we asked her if she wanted to get checked. We practice in a very rural area. A lot of the moms don't want to get checked, but Claire did want to get checked. So I started off with having her lay semi-reclining position and take her bottoms off and have her, so I'm going to kind of show this, have her feet, the bottoms of her feet come together and just let her knees fall to the side and try to relax as much as she can, which I know is not easy. And then I would take my right hand and use my left hand just to kind of press on her belly a little bit. Put gel on my 2 fingers, and then talk to her through the whole thing, so you'll feel my gentle touch on your thigh. I'm sorry, the gel is really cold. We'll spread her labia apart and insert the 2 fingers to like my pelvis. And we're gently putting in the 2 fingers, examining the front of the vagina, and then inserting it downward and backwards, so against the vaginal wall, and making sure that our thumb is not close to her clitoris. What we're looking for is checking baby's position, like if we can feel the baby's head, the effacement, how thin her cervix is at, and if her cervix is dilated. And if we can't reach the cervix, like if it's very posterior, we would have her make 2 fists and put them underneath her back, and then do a downward pelvic thrust and an upward one. So it kind of brings her cervix up front. Which with Claire, we did feel her cervix. She is about at a 5, I would say. Her cervix is fairly thin, but not 100% effaced just yet. We didn't feel the baby's head. It seemed to be kind of further up, but we did feel the bag of water, which was really thick. If we were to feel the baby's head, we would feel for the sutures. So if the sagittal suture is going up or down, if it's like this, if it's not in the center of the pelvis, like if the head is coming down asynclitic, that's something to watch out for too. And then the decision after that was me to stay. So normally if they're effaced at like a 2, so I work with 2 preceptors. One of my preceptors would leave and let them labor on their own. But I have noticed that if they're dilated at a 5 or 6, then we stay. So we start bringing in our equipment, and we start setting up, and we start monitoring her. So during this part of labor, we would listen about every 30 to 40 minutes. We'd listen to the baby. Once the contractions get closer and stronger, we listen 15 to 20 minutes, and then every other contraction when she's getting close to pushing. That's about it.